It's a pleasure to be here today. This week is Racial Equity Week, as some of you may know, and I can't think of a better place to kick off our celebration than recognition of our own historic Provident Hospital. We have a distinguished panel here to talk about the hospital's groundbreaking contributions to racial equity in healthcare and how we have to continue to focus our efforts to eliminate health disparities in Cook County across the nation. Before I go any further, I'd like to introduce our two commissioners who are with us. Commissioner Donna Miller, would you please stand? And Commissioner Monica Gordon. Thank you both. So they're Cook County Board Commissioners, and in the back we have Joe Harrington, who's a member of Cook County Health and Hospital Board. Joe, are there any other Health Board Commissioners here? Pardon me? Oh, Otis, yes, how could I forget? All right, and last but not least, Otis Storing. Where are you, Otis? Okay, he is a Deputy Chief of Staff in Cook County and also a board member of Cook County Health and Hospital System. Cook County has continued to invest in the Provident campus and has increased services to meet the needs of our patients. We believe Provident is a cornerstone of our health system, and we're committed to preserving its legacy and forging a sustainable and equity-driven path into the future. I'm proud to say that earlier this summer we celebrated the second annual Provident Scholarship Fund right here. The scholarship is funded by Cook County Government, Cook County Health, and the Cook County Health Foundation. Provident Hospital Scholarship Fund is one of the many educational initiatives supported by Cook County, including Project Rainbow, which aims to inform, inspire, and impact children, students, and families across the county. This year we awarded 60 Provident Scholars, a total of $1 million, to support them in their educational journey. These students are from and are committed to caring for underserved communities and our future healthcare leaders. We know that when healthcare providers are reflective of the communities they serve, patient outcomes improve. By providing these scholarships, Cook County is working to build out our future workforce, remove financial barriers for underrepresented students, and improve racial and equity and health equity for the residents of Cook County. I'd like to recognize some of the special guests we have here today. Dr. Marc Sengstacke, Ms. Dilla Sengstacke. Is she here?
She won't be able to make it.
Oh, okay. Representing the Sengstacke family. We'll soon hear more about the Sengstacke's vital contributions to reopening of Provident Hospital and to using their platforms to advance racial equity, not only here in Cook County, but across the nation. Now I'd like the panelists to introduce themselves. We'll start at the very end there. Claudia, you're first up.
Hi, I'm Claudia Fegan. I'm the Chief Medical Officer for Cook County Health.
Marc Sengstacke, Executive Director, Chicago Defender Charities.
Hi, good afternoon, everyone. Rocha, CEO for Cook County Health.
Sherman, Dilla Thomas, Chicago historian.
Okay, thank you all for joining us today. I'm going to begin with Israel. Can you tell us a little bit about the state of Provident today?
Sure, and as we said, I really want to start everybody by welcoming you to Provident. On behalf of the Provident family, I would say that Provident, can everybody hear me? I would say that Provident right now is incredibly strong, vibrant, and growing. Just over the last few months, we've spent $9 million to modernize Provident. We have increased our inpatient bed complement. We have reopened our intensive care unit. We have reopened our emergency department back to ambulance runs. We have added new specialists and welcomed new physicians, including our specialty services, including dermatology, vascular, plastics, neurology. We've also brought in new intensive care units, expanded our internal medicine complement, and we have also, over the past year, have been able to open our outpatient dialysis program, and it is increasing to have an even larger number of census. We have started inpatient dialysis to make sure that patients who need those services can stay here at home in the community and not have to travel long distances. And that really has been the driving motto of what Provident has wanted to accomplish is what can we do safely and what can we do with a quality aspect and ensure that people can stay here at home. and really try to make sure that we are making a sizable impact and difference in the disease pathology that we continue to see here in our community. And that includes being able to have additional funding that was recently done by installing a new MRI machine, expanding our operating surgical capacity, and also upgrading our campus facilities, including the things that sometimes don't get seen but are behind the walls, our plumbing, our electrical, our maintenance, which all ensure that we're able to render the safest level of care. And so I would say that, and our team has also has been more resilient than ever to make sure that we're here for the community. So overall, I think that Provident is definitely Provident strong, growing and vibrant, and we're very excited about the wonderful work that the team is doing.
Thank you. Thank you very much. So let's go back to the inception of Provident Hospital in 1889. The 1800s were a period of industrial boom in Chicago. Large factories were being built. There was lots of economic opportunity, which brought people from around the country to Chicago. Pullman, Roseland, Kensington were being built, and there was a small but growing African-American population. Needless to say, racial and ethnic segregation was the rule, from employment, education to housing and health care. And in 1889, a handful of individuals built Provident Hospital. We'll start with Dr. Fegan and then Dilla. Tell us what happened.
Thank you. Emma Reynolds wanted to go to nursing school, and she applied to all of the nursing schools in the Chicago area, and she was denied admission based on her race. So she went to her brother, Reverend Lewis Reynolds, and he approached Daniel Hale Williams. Now, Dr. Williams assumed that he would be able to appeal to a nursing school to accept Emma, but that was not the case. And so then the idea of building a hospital and a nursing school was born. So Dr. Williams convened a group of black ministers and local business owners and physicians. There were not that many black physicians on the South Side at that time, and even fewer of them who had hospital privileges. And so they began a fundraising effort. The Armour Meatpacking Company provided them with a down payment for a house that was at 29th and Dearborn. And there they opened a 12-bed hospital for the express purpose of training nurses. The Provident Hospital opened on August 17th, 1891, and its first annual budget was $5,400. Emma was a member of the first class of the Provident School of Nursing in 1892. And by 1897, Provident had 189 inpatients, an outpatient clinic. The Armour Dispensary treated 6,000 patients. So that was a modest beginning to where we sit today.
All right, our historian's going to add a little bit here.
Yeah, the good doctor summed it up pretty well. One of the things that I would like to add to it is that Dr. Daniel Hale Williams was, by that point, a sincere heavyweight in the medical society of Chicago. He's the physician that trained Christian Finger, and Christian Finger trained the Mayo brothers, and so his assumption that he would be able to get Emma Reynolds into a nursing school was very sincere. The other thing that I like to point out that speaks to the inclusive nature of black folks on the South Side then and now is, despite being denied admittance to basically every hospital in the South Side of Chicago, the very first patient of Provident Hospital was an Irish dude from Bridgeport who needed care. Right, that was their very first patient of Provident Hospital, was an Irish guy from Bridgeport. Provident Hospital becomes this beacon not just for people who need medical attention in this community, but there's a place in the world called Meharry Medical School. It's one of the only schools, historically black college, that teaches and educates doctors, eye doctors, dentists. But once you graduated there, good luck trying to get a surgical rotation. So Provident Hospital also becomes this institution that allows for trained black doctors to actually get practice in the field of medicine. And then the thing, I thought the good doctor was stated, but it has the distinction of being arguably the first place in the world to successfully perform an open heart surgery. Dr. Daniel Hale Williams performed that surgery in 1893 at Provident Hospital on a guy by the name of James Cornish. Sadly, James Cornish was stabbed, and Dr. Daniel Hale Williams sewed up that sack that his heart sits in. I'm a historian, not a doctor. I don't know the name of the sack that he sewed up. Yeah, but it was a sack that our heart sit in, and he sewed it up, and that was done without the aid of an X-ray, right? That was done without the aid of these LED lights. So it's a very, very important institution to not just Black Chicago, but America.
Got you there. Provident is home to several notable firsts. You talked about a couple of them, training African American women to be, at that time it was women because I don't think there were any guys who were nurses, but anyway, training African Americans to be nurses, performing the first open heart surgery. Any other kind of firsts you want to share with us, or what you want to say about the legacy of Provident?
One of the things that I like to point out that there's an incident in our city's history, the Chicago race riot of 1919, and during that time, individuals outside of what we call Bronzeville were bombing houses and Black businesses, and Provident Hospital didn't get touched. That's because the Black World War I veterans who were newly home from war circled the hospital and wouldn't let anything through. We drive down Michigan Avenue all the time, and there's the George Cleveland Hall Library branch. One of the most beautiful libraries in the city, but two, who is George Cleveland Hall? He was a surgeon at Provident Hospital, and he's one of the founders of the Chicago Urban League. And so again, when you're in a city that doesn't allow for true integration, just even in thought, Provident Hospital doesn't just become a place where you go for treatment. The banquet halls are places you go to have meetings to form the Chicago Urban League or to form the Association for the Study of Negro Life and History. And so it provided a safe space, not just for health, but for thought. And it should equally be thought of in that manner as well.
As a community resource, as well as a healthcare institution. Israel, you want to add anything, Dr. Fegan? I think you've got that one. Yeah. You want me to give you this one?
No. Well, he already mentioned the Daniel Hale Williams in the first open heart surgery, which was no small feat. But Dr. Williams was highly regarded in the field of medicine, and he is not just because he was innovative, but because he cared for the community. And he changed people's thinking about who could do what. He had the courage to attempt to save this patient, which he did, and that changed the way people looked at Black physicians. And it took a long time, but it's a significant note that this was the first open heart surgery in the United States, because no one else had attempted to do that before. So we always like to remember Dr. Williams.
Loud.
That's all right.
But what he goes on to accomplish after that, there's a place in Washington, D.C. at that time called Freeman's Hospital. It's a hospital that was opened by the government for Black Civil War veterans. But up until that particular open heart surgery, the nurses there were white, the doctors were white, the administrators was white. The distinction of Provident Hospital is that the nurses were Black, the doctors were Black, the administrators were Black, and then after he performs this successful open heart surgery, he becomes the head surgeon at Freeman Hospital, which again didn't just exclusively treat Black Civil War veterans, it treated all Civil War veterans. And to the doctor's point, that opens the eyes of the medical world about what African American doctors could do. And then I like to speak to his bravery. If you've ever spent any time looking at a picture of Dr. Daniel Hale Williams, he could have certainly passed. He didn't have to advocate himself as a Black man or a race man is what they would refer to themselves in the 1890s. And he very actively proclaimed himself as a race man. I am a Black doctor. And it was something he certainly did not have to do. The history is full of there's another, Harry Pace, right, a great Chicagoan who did a lot of things. He spent the first half of his life passing as a white man to make things easier for his businesses. And Dr. Daniel Hale Williams never did that, despite he could have totally did that. And I'd like to acknowledge that in his legacy as well.
Thank you. Anybody else want to add anything? I would say that we've been joined by Commissioner Stamps. Thank you very much for joining us, Commissioner. And Otis Story, you want to Wave 2, Otis Story, member of our Board of Cook County Health. Go ahead.
The only thing I would add also in sort of just addition to the larger conversation is that I think the most beautiful thing about Provident Hospital and what it means and its history and place in our community and why it's important to our system to continue to celebrate it is that oftentimes when we are trying to make a change in our community at home, we can make a change for the larger world and serve an inspiration. And I think that what Provident really has meant in the place of our history is that there is a place, and not just a place, that there is a mandate for everyone to be included in healthcare. And in a time when people weren't being served, people were being ignored, people of different backgrounds, different colors, different ethnicities, languages, they were being minimalized and made almost to be less than what others would be served, and that there was an action to change that and to say that healthcare was for everyone, and to start today what we say in our mission, that that health is a human right for everyone, really started with the cornerstones and the bravery of people who started Provident, Dr. Williams, and others who made it, kept going, and those who have kept it moving forward. And so the legacy is that it is, and we are celebrating Dr. Williams, but it is very much every staff member who's ever worked, every commissioner, every leader, every elected official who's helped it keep going is what keeps Provident alive. And so today, it is a strong and vibrant hospital, but it's also an idea that healthcare is and should be for everyone on equitable terms so that everyone can have access to the most exceptional healthcare possible. And it's both visionary, a legacy, and part of our future. And so I think Provident is a special place in our healthcare continuum here in Chicago, in Cook County, and across the country.
Can I add something?
Of course.
Mr. Sengstacke had all three of his children were born in Provident, and I remember seeing pictures from years ago in the Chicago Defender newspaper of his association with the hospital, and he was motivated by having a hospital that was available to the underserved who otherwise would not have the opportunity to have hospital care. I remember one time, and he was excited about being on the board, about being chairman of the board to build the hospital. I remember one time, and he told me a lot of stories about his efforts. And one time I was in his office at the Defender building when we were on 24th and Michigan. For years he had wanted this to be a 500-bed hospital. And he mentioned to me at that point that he changed his mind and that he agreed to push for a 300-bed hospital. He had this reluctant look on his face. And I remember that, and I can hear that in his voice now. And all this goes to what we've been talking about, and that is the absence of health care for the disadvantaged. I remember listening to someone on a program not too long ago, and they were talking about how African Americans did not purposely choose to live in neighborhoods that suffered from redlining, that suffered from environmental pollution, environmental injustice. It's something that was forced on us, and that is all a part of, unfortunately, a part of this atmosphere that we feel today. Emma Reynolds, Dr. Williams, Mr. Sengstacke, all of those who were and are a part of this institution, from frontline employees on up to President Preckwinkle, we are all dedicated to making sure that someone who is sick, who is in pain, who otherwise cannot get medical service, will get it through this hospital.
Thank you. Thank you, Mark. Just to review a little bit of history here, you see the signs on the windows that say 30 years, 1993 to 2023. So let's talk about how we got there. The hospital, as you heard, was located in the South Loop early on. It moved to 51st Street in 1933, and then into a new 300-bed facility, as Mark said, with federal grants on the adjacent lot in 1982. However, the 1980s were a time of great challenges for healthcare institutions in this country. A number of hospitals closed, including Provident in 1987. And without Provident on the Mid-South Side, many residents were left without access to care. So, Mark, let's come back to you and talk about the reopening of the hospital in 1993, 6 years later.
That was a struggle of everyone, including Mr. Sengstacke, to reopen this hospital. It was a commitment he had because there was a need. And the Chicago Defender newspaper has always been based on fighting to resolve a need regardless of the circumstances, the challenges. And Mr. Sengstacke used his influence that he built up with the Chicago Defender to not only build this building, but also to help reopen it 30 years ago. And it's all part of Mr. Sengstacke's goal, of everyone's goal. I remember Mr. Sengstacke telling me years ago, he said, I enjoy helping people. At first that didn't, ironically, that didn't stick with me, but it did years later. And it's again because there are people in need. And when someone is in need, they don't care who is running what. They want relief from their pain. That's what this hospital is doing. And I want to say, I don't know if I can say on behalf of the deceased, however, I will say on behalf of Mr. Sengstacke, I think he would be proud to see how the county, how you, President Preckwinkle, and your team have led the efforts to invest into this hospital, because what this hospital is doing now is what Mr. Sengstacke fought for years.
Thank you. Want to add something?
I think Brother Sengstacke summed it up very well. The importance, we'd be here all day if I listed out all the things that we owe the Chicago Defender here in this city. Morgan Park is one of the last neighborhoods to annex itself into Chicago. And when it did, it had the intentions of segregating Morgan Park High School. And it got really, really close. And when they admitted the first couple of black high school students in, the seniors stopped coming to school. And so the principal panicked, and he was going to start segregation. And the Chicago Defender, our journalist, found out about it, and that story put a stop to it. Right down the street, we call the high school DuSable High School today. When it got opened, it was New Phillips, because we had a Wendell Phillips already, so then they opened New Phillips, because the city of Chicago was not going to put John Baptiste Point DuSable's name on anything. And the Chicago Defender started a naming of the high school competition, and that's where that name comes from. It's, as Brother Sengstacke would say, is the mouthpiece of 13 million black folks for a very long time in this country. And then to just even in that few years that the hospital closed, right, if you check the stats, you'll see that asthma rates increased and deaths from asthma attacks increased. You would see that amputations, because of the lack of diabetic services, increased just in the footprint that we call Bronzeville. And it was only closed for a couple of years, and so getting it back open was pivotal to this community.
Thank you. So the next question, Israel, is what does the future hold for Provident?
So I would say the future holds a pattern of continued investment in services in Provident. We want to continue to invest in creating new state-of-the-art modalities here at the Provident campus, continuing to bring on additional services. As we've always said, I sometimes get the question is, what is the growth plan for Provident? And I say it is growing now. But the most important thing that we can do, and we are doing the study to look at and envisioning what campus modernization looks looks like, the most important thing that we're doing now is bringing back the service, the specialists, the physicians, and the providers. That's the most important thing, and that is easier to do because it's moving and getting brilliant minds here onto the campus. And that immediately brings services. That immediately brings relief. That immediately brings access. And so issues of complications for diabetes, for oncology, for needs of physical therapy, for patients to go outside this community, get resolved immediately when they are here. And so the future is to continue to bring those specialists here, whether it's gastroenterology, whether it is oncology, more cardiovascular services, more neurologists, more neuro capabilities to diagnose and manage the comorbidities. That is what we're invested in making sure that it's here at the Provident campus. Because there is one thing that we are committed to at Cook County Health, and that is ending the story of two cities. And that is where you have certain communities in Chicago and Cook County that their average mortality rate is in their 60s and 70s, and you have others in Chicago that their mortality rate is 80. And we know that the real difference between those challenged communities is the comorbidities that we're wanting to address, which is cardiovascular issues, neurovascular issues, pulmonary issues, things that we can address, that we can diagnose, that we can treat, and we can help. And so we are committed to making sure that we make those investments throughout our system, throughout our hospitals, and throughout everything that we do, even across our public health modalities, across our correctional health modalities. Wherever we have a footprint, we are committed to changing that. And that is the story of Provident, and an important part of where we're going in the future.
Thank you. All right, final words. We'll start with you, Claudia. Come on.
You know, I just want to circle back to the 30-year celebration because it took a lot of people to swallow egos. You know, Cook County bought Provident for $1, and another county board president, Jim Phelan, they invested $53 million to reopen the hospital. So that was a big deal. It was important for the community because the people who live in this neighborhood, and I live in this neighborhood, had nowhere to go. And so it's important that people feel that this is their hospital. And I can't be more proud than the physicians who come here, the physicians who work here, the nurses who are taking care of, and everyone who works in this hospital is committed and often a part of the community that we serve. And we know that outcomes are better when patients have people who are not just caregivers, but they're neighbors and friends and family. And so there is something about the feeling when you walk in the front door of Provident where people greet you and you feel like you're a part of the family. And so we enjoy the privilege of taking care of the community we serve. And so I think the future of Provident is bright because people want to be here and want to do the work that it takes to make everyone benefit.
Mark?
One of the unfortunate factors we're facing today is that there is this normalization of antagonism against equity. There are forces that are telling us that those who have suffered at the hands of racism and other isms, that we, the victims, are actually wrong in protesting against isms. That's becoming normalized. You look at what's happening in Florida. Look at what's happening with the closing of libraries. Look at how information about African American history is being removed from history, as if African American history is wrong. And it's this force is something that faces all of us as Provident continues to improve, to better serve the African American community, the underserved community. As Provident does that, it is unfortunately going against these forces, and we need to realize that those forces are out there, and we cannot let ourselves be fooled into thinking that somehow we're wrong by expanding health care so that it is available to the underserved. That means we have to take part in the electoral process. We have to understand the candidates at all levels of government. We have to listen to the news. We have to make sure that our young people are informed and that they understand their history. The items that Mr. Thomas brought up about the incident at Morgan Park High School, the campaign the Defender had at DuSable. Now, I'm of the Defender family. This is my first time hearing about it. And I will admit there's a lot I don't know. There's a lot I do know, there's a lot that I don't. That just goes to underscore the importance of letting our youth know about our history, their history, and letting everyone know so we can make informed decisions. And on that, I will pass the microphone on to Dr. Rocha.
I'll let you be last. Go ahead.
All right, well, now I'm on the spot. As a future holds, I think everything in life needs a farm system, right? When the Cubs finally broke the curse because of the people they had in the farm system came up, and so it's never too young to start that. I would like to see the leaders of Provident, the leaders of our county, find a couple cohorts of second and third graders and make it their business to be here as much as possible to learn what this space does and how this space can continue. The other thing I want to say thank you to the healthcare workers and those here, because whether you know it or not, health services stop violence here in Chicago. And since I'm not the only dude with any title that can get voted out or fired, I'll be very honest. There's a difference between when someone gets shot and they survive and when someone gets shot and they pass away. When that person survives, all of his friends are at the hospital hoping he pulls through and there's some conversation. When he doesn't make it, his friends are out trying to get revenge, and we're in this cycle. When the grandmas and grandpas of the world pass away at 66 because of preventable diseases, that's the mentors in the neighborhood that can teach us things about our future, about our community, right? I'm sitting here because I had some grandmas and grandpas that lived to be in their 80s that was able to teach me things as they learned them through life, and it sheltered me today. And so I think it's a very bright future, because the more lives we save on the South Side, the more that an auntie and a grandma gets to go home after a medical emergency, the safer her community is, because those are the only people that can reach those people who have decided to be on the other side of the street. I speak at schools nowadays, and what I tell all the kids is I cannot check anyone I don't check on. And so the aunties and the grandmas in our communities are the ones who check on those babies, and services like this keep them checking on our babies. So I think the future is going to be very, very bright. If I only can add anything, put it all on social media. 10 years ago, if something happened on the news, it became a meme. Now, when something's a meme, they talk about it on the news. And so every time you do something amazing here, it needs to be on a social media platform, because the kids aren't going to learn about it in the Defender or the Sun-Times, right? They will learn about it on Instagram. And I'm very, very honored and proud to even be sitting in this space with you all, because this is an important institution to not only the city but to the country.
I'd like to thank all of our panelists, Israel Rocha, Marc Sengstacke, Dr. Fegan, and our historian here, fellow historian, Mr. Thomas. Thank you so much. I'm grateful, too, for the staff of Provident Hospital and the good work they do each and every day. Grateful to be joined by our commissioners, again, Commissioner Miller, Commissioner Gordon, Commissioner Stamps, who has joined us, and Otis Story, our Deputy Chief of Staff, was on the board of Cook County Health, as well as Joseph Harrington, Cook County Health Board member. Thank you very much, Dr. Rocha. Dr. Rocha. Israel Rocha. All right.
Thank you. I just wanted to say before we go, I really did want to thank President Preckwinkle, the Board of Commissioners, and the community at large for continuing to support Provident Hospital, our team, and everything that we do. I would say we are only half the equation if the community doesn't support us and if we don't have the investments that we receive. So especially today, in recognition of the leadership that you do to make sure that we can keep operating. Thank you very much, President Preckwinkle.
Of course.
And to everybody.
Yes, thank you.